Hey, I'm going to tell you something that nobody in mainstream media wants to talk about. And the reason they don't want to talk about it is because it's terrifying. 56% of Americans, that's more than half of us, can't cover a single $1,000 emergency. Not without going into debt, not without disrupting their life. Now, if you're someone who's worked your whole life, saved responsibly, you might be thinking, well, that's not me. But wait, let me show you what the data actually says. For people ages 55 to 64, people who are literally about to retire, the median retirement savings is $185,000. Let that sink in. After 40 years of working, that's the middle number. And here's the one that really gets me. 40% of baby boomers have zero retirement savings. Zero. They're about to stop working, and they have nothing put away. This isn't isolated cases. This is tens of millions of Americans staring down a retirement that looks fundamentally different from what they imagined. I want to introduce you to three people. Their names are Sarah, Marcus, and Linda. I've changed the names, but their situations are real. Very real. Sarah is 58. She's been a public school teacher for 34 years. She loves her job, but she knows her pension alone won't cut it. She's got about $240,000 saved up. She wants to retire at 65. She owns her home, but the mortgage will be paid off right when she retires. Marcus is 61. He's been an ICU nurse for 28 years. His work has been incredibly rewarding, but also incredibly stressful. He's got $310,000 saved. He has a wife who hasn't worked outside the home for the last 15 years while raising their kids. They have no pension. Linda is 62. She owns a small digital marketing agency. She's been running it for 18 years. She's got about $380,000 saved. She has a wife, and they own a vacation property in addition to their primary home. On paper, these three people are ahead of the game. They all have saved six figures. They should be fine, right? Except they're not. And the reason why is what we're about to break down. Here's the thing about retirement that financial calculators and online tools don't capture. You live a long time. The average American male who makes it to 65 will live to 84. The average female will make it to 87. Some will live to 95, 100, even beyond. So if you retire at 65 and live to 87, that's 22 years. 22 years where you're no longer earning income, but you still have expenses. Now, here's the cost that demolishes retirement plans. Healthcare. Medicare starts at 65, which is good, but Medicare doesn't cover everything. You've got premiums, deductibles, coinsurance, and the things Medicare doesn't cover? Those can be catastrophic. The average couple retiring at 65 today will spend about $315,000 on healthcare in retirement. That's not including long-term care, which could add another $100,000 to $200,000 or more. For our three people, Sarah, who's single, is looking at roughly $180,000 in healthcare costs alone between 65 and 87. Marcus and his wife? They're looking at that full $315,000 for the couple. Linda and her wife? Same thing. Now let's do the math. Sarah has $240,000. Her pension will give her about $2,200 a month. Social Security, when she takes it at 67, will add another $2,100. That's about $4,300 a month in guaranteed income. But her house costs money to maintain. Property taxes in many places have gone up 3 to 5% a year. Her house needs a new roof? That's $12,000 to $20,000. Car breaks down? Another $8,000 to $15,000. These aren't hypotheticals. These are things that happen in a 22-year retirement. Plus, she wants to live a life. She wants to see her grandkids. She wants to take a trip. She wants to eat well. That all costs money. The real retirement budget for Sarah, accounting for healthcare, maintenance, property tax increases, and a modest lifestyle, is probably closer to $3,500 a month. Not a luxury retirement. A normal one. Her guaranteed income is $4,300. That sounds okay. But wait, what if she has to retire before 67 because of her health? What if she needs long-term care at 82? What if she lives to 95? Now her $240,000 in savings looks a lot smaller. Here's what we're seeing in 2026. People are hitting retirement with less saved than previous generations. Healthcare costs are rising faster than inflation. Property taxes are rising. The lifestyle inflation that happened in their 40s and 50s is hard to reverse. And This is critical. Many people are discovering that their job gave them structure and purpose. Without it, they're spending more to fill that void. More hobbies, more travel, more medical appointments, because they finally have time to care for their health and discover things that need fixing. The retirement crisis is real. But here's what's also true. Most of it is preventable. And if you're already in it, most of it is fixable. The problem isn't that people don't want to save, it's that they don't know what they're saving for. They don't know the real number. They don't know the hidden costs. Sarah, Marcus, and Linda weren't irresponsible. They weren't lazy, they worked hard. But they didn't account for the things that actually matter in retirement. So here's what changes the equation. First, know your actual number, not a generic 1 million or 2 million, your actual number. What do you actually spend now? What will you spend in retirement? Healthcare, housing, travel, all of it. Run the math. Most people discover they need 30% less than they think, or 50% more. But at least they know. Second, if you're behind, it's not over. If you're 55 with 150,000 saved, you can still catch up. You can work 3 or 4 more years. You can earn more in those years. You can save more aggressively. A 55-year-old with 150,000 who works to 62 and saves aggressively can easily get to 400 to 500,000. That changes everything. Third, optimize your accounts. This is technical, but it's worth thousands of dollars. Roth conversions, strategic Social Security timing, tax-efficient withdrawals. A good financial advisor can save you tens of thousands in taxes over retirement. Fourth, downsize intentionally, not in panic. This is where most people go wrong. They wait until they're desperate, then they sell their house too fast at a bad price. If you're going to downsize, do it while you still have income, when you can shop for the right place and not take a loss. And fifth, plan for healthcare. This is the biggest variable. If you can stay healthy, exercise, preventive care, stress management, you can reduce your healthcare costs significantly. And know your Medicare options. There's a lot of money on the table if you understand how Medicare works. The retirement crisis is real, but it's not inevitable. It's addressable. And the sooner you know your actual situation, the sooner you can do something about it.